His Excellency, Mr. Prime Minister of Turkey, Professor Nisan, President of the Green Crescent Society of Turkey, Excellencies, Honorable Ministers, distinguished delegates, friends and colleagues in public health, civil society organization leaders, ladies and gentlemen, good afternoon to all of you, and of course, friends of the media. It is an honor and a great pleasure to participate in the opening ceremony of this Global Alcohol Policy Symposium. The large number of countries represented here today is a signal, a strong signal of the growing concern about the harmful use of alcohol and growing determination to take action. Health officials gave us a similar signal last year when Thailand hosted a global alcohol policy conference. These events, friends, tell us that action at the policy level is needed. They tell us that action is deeply desired by many governments, by many civil society organizations, and by the many millions of people around the world who have seen their lives, their families, careers, and communities devastated or destroyed by the harmful use of alcohol. This includes the many people who have lost a relative or loved one following a drink driving incident. Alcohol consumption can harm the user, but it can also harm the innocent. Harmful drinking causes immense damage to health and to societies and imposes a heavy burden on health systems and health budgets. It is a major risk factor, and it is largely avoidable. Alcohol can be a killer. WHO estimates that the harmful use of alcohol is responsible for around 2.3 million deaths every year around the world. Alcohol can kill slowly, as it gradually contributes to diseases like cirrhosis of the liver and cancers at several sites. Harmful drinking is also a major risk factor for cardiovascular diseases. Alcohol can kill quickly too, sometimes instantly, when it contributes to traffic crashes, injuries, violence, violent crime, and suicide. Harmful drinking makes a significant contribution to ill health and disability. It is a major risk factor for a range of neuropsychiatric disorders, which increase the burden on health systems and societies even further. Harmful drinking is linked to much more than an increased risk of chronic non-communicable diseases. Through various mechanisms, harmful drinking increases the risk of infectious diseases like pneumonia and tuberculosis, and has a negative impact on treatment outcomes, also for HIV/AIDS. Alcohol consumption, ladies and gentlemen, as you have heard from Professor Nisan, during pregnancy can cause permanent physical and mental damage to child. Bluntly stated, alcohol is a teratogen for the developing fetus. These risks, this tragic and costly human harm, is largely avoidable. Reducing the risks require population-wide measures. Introducing these measures require high-level commitment, and it requires a great deal of courage. Ladies and gentlemen, the job we face is not an easy one. We know it. A societal problem like harmful drinking has multiple dimensions and contributing factors that extend well beyond the health sector. The health sector, working alone, cannot implement an adequate range of effective alcohol policies. Depending on the national context, efforts to protect populations from the harmful use of alcohol can require support from fiscal policies, trade policies, the judicial system, law enforcement, and government ministries responsible for youth and families, road safety, consumer affairs, and commerce. On the positive side, all countries wishing to introduce or strengthen alcohol policies have a powerful instrument to assist them, and this is the global strategy to reduce the harmful use of alcohol, endorsed by WHO member states, 194 countries, endorses strategy in 2010. This is a powerful strategy. It sets out a menu of policy options and supporting interventions for reducing the harmful use of alcohol. Each country can draw upon this menu to craft effective and affordable policies that match distinct national problems and priorities, as expressed in distinct cultural and religious contexts. The strategy was carefully developed during a wide-ranging negotiations and consultations that lasted nearly 3 years. Its unanimous endorsement was a landmark for public health, for WHO, and for its member states. Policies and their supporting interventions are based on solid scientific knowledge, backed by evidence of effectiveness and cost-effectiveness, and supported by practical experiences within countries. This diversified menu of options is organized around 10 recommended target areas for action. Actions range in nature from community action to responses within health services and to a number of regulatory measures. Regulatory measures are particularly effective in preventing deaths and injuries from drink driving, constraining the availability of alcohol, and reducing the impact of marketing, especially marketing on young people and adolescents. Ways of countering the problems of illicit alcohol and homemade brews are also included. Increasing the price of alcohol beverages is one of the most effective interventions to reduce the harmful use of alcohol. For this approach to be successful, countries need to have in place an effective and efficient system for taxation, matched by adequate tax collection and enforcement. Unfortunately, alcohol consumption is expanded rapidly in precisely these countries that do not have the regulatory or other capacities needed to protect their populations from alcohol-related harm. On the positive side, research tells us that strong alcohol policies work. A reduction in the density of stores selling alcohol has been shown over time to reduce child maltreatment and drink driving. Having fewer outlets that sell alcohol are also linked to fewer traffic crashes and accidents for the pedestrians. Restrictions on the times when alcohol is available also have an impact. In one city in Australia, late-night assaults declined by nearly 40% when closing hours for alcohol purchase were turned back modestly. In a city in Brazil with one of the highest murder rates in the country, the introduction of restrictions on alcohol availability was followed by a 44% decline in murders. Price matters greatly, ladies and gentlemen. A recent systematic review suggests that doubling taxes on alcohol could reduce alcohol-related deaths by 35%, fatal traffic crashes by 11%, and the rate of sexually transmitted diseases by 6%. Studies also show that taxes on alcohol can help prevent people from starting to drink. This approach is especially important in the many low and middle income countries that have high numbers of lifetime abstinence. Ways to curtail the initiation of drinking are becoming more and more important because these are important measures to counter the aggressive marketing of alcoholic beverages. In short, ladies and gentlemen, national alcohol policies are needed, desired, and entirely feasible, and highly effective. Friends, colleagues, the most important requirement for success, the item that heads the list of 10 recommended target areas, is leadership, awareness, and commitment, as we are seeing here in Turkey. Turkey has this leadership at the highest political level. And I want to thank you, Prime Minister. I thank you for your personal leadership in this initiative to reduce the harmful use of alcohol within Turkey. Friends, colleagues, before we came down to join you, I had a very good discussion with Mr. Prime Minister. Honestly, I asked him to appoint me as his honorary ambassador. Why? This is a country in 10 years' time, transform the health of its population in 10 years instead of in a generation's time. What more can you ask for a Prime Minister, right? The leadership he has shown in forging tough policies for tobacco control, not just alcohol, tobacco control for road safety, goes beyond safeguarding the health of the Turkish people. It is a model for other countries to follow, and it is a source of great inspiration and encouragement. Following a tobacco control law in this country in 2008, smoking preference among Turkish adults has declined by an impressive 13%. This recent success is all the more remarkable given the historical importance of tobacco production to the Turkish economy. For a government who rely on tobacco as a source of income and have the determination to take the right action to counter the harm tobacco that will bring to its people, and now the harm that alcohol can bring to its people. That's why, sir, I want to work for you. I don't get any pay, that's okay, I don't need that. I want more presidents and prime ministers like you. Let me once again thank the Turkish government for using lessons in your success to assist other countries in their tobacco control initiatives and also moving beyond to alcohol. You know, friends, I visit many countries and I had the opportunity to meet with many leaders of the world. I'm always thrilled when a head of a state or head of governments make protecting the health of citizens a flagship item on the political agenda. I have seen more and more leaders are doing that. My enthusiasm is fully justified. Some of the biggest threats to health in the 21st century need political solutions, and not just medical and technical ones, as important as they are. Health all around the world is being profoundly shaped by the same powerful forces: demographic aging, rapid urbanization, and the globalization of unhealthy lifestyles. The health and medical professions can plead for lifestyle changes, tough tobacco legislation, strong alcohol policies, and healthy diets. We can diagnose patients, treat them, and issue the medical bills too. But more importantly, we, the health professionals alone, cannot re-engineer social movements, the social environment, in ways that encourage healthy behaviors and protect populations from harm. Improving the environment in which consumers make their choices a political and healthy choice is the job of all of us. But when countries put public health interests above the powerful economic operators like the alcohol and the tobacco industry. This is what I meant by it, and really the enthusiasm and inspiration I get from governments. As I said earlier, to do that, it takes courage. And I thank Turkey, its Prime Minister, its health ministers, and all other ministers that I have met with. Sir, you truly believe in the whole of government approach by bringing together Minister of Education, Health, Family to tackle alcohol, to address the harm of harmful drinking. I salute you and I encourage you to do more. I look forward to come back in times to come to see your excellent progress as you did in alcohol. Let me once again thank you for this opportunity to join you.